Hi, I'm Dr. Charlie Schuster here at Back to Health in Charleston. I want to talk to you a little bit about today about something that we've had great success with in our clinic, and that's treatment of knee osteoarthritis. So, chronic knee pain that doesn't go away with painkillers. Patients who come here may have been told by their doctor that they need a knee replacement. Others that they just need to quit doing some of the things they really love and activities they enjoy. And we'll have none of that here at Back to Health. Our goal is to help people enjoy life to their fullest. We all only get so many good days in our life. We want to have as many as we can. So when someone presents to our clinic with knee pain, I want to tell you what makes us so different. And first and foremost is that you know that in the back of our mind at all times while we're evaluating, we're very concerned about what is causing the problem. Because even if you can correct it for now, what's to say it isn't going to come back later if we don't find out why the problem is happening? So usually we're seeing that joints are wearing out before they should, and many times that's because weight has been borne through that joint incorrectly for many years, even sometimes decades. But we make sure that when we evaluate that we address the cause of the knee problem, and not just the knee problem itself, because you can probably get relief pretty quickly with something like cortisone injected into the knee, and many of our patients have had cortisone. And although that's a powerful anti-inflammatory, it also comes with side effects. Side effects can include earlier degeneration of the cartilage. It speeds that process. It can also cause loss of bone in the area, which is the area we're actually trying to create more health and more vitality in, and it's actually having a negative effect on bone. It can alter your blood sugar, and so even if it does help, it typically doesn't help as much the next time, and then eventually it doesn't help at all, and then it's not uncommon for our patients to have already had a recommendation to have a total knee replacement. So we start off in here when we can treat a patient and help that patient. We want to note that we have an all-natural gel that we use called Suparts. We're preferential to Suparts because it's actually put in 5 times into the joint, and we use a diagnostic ultrasound to be able to see into the joint. Some practitioners, doctors, physician assistants will put injections into the joint, and they've done it enough, they feel comfortable not using any imaging, but we absolutely feel like we want to make sure whatever we would put in your joint to help it is going into the joint. And so for that reason, imaging is something we always use in here. Suparts, although it's a 5-week shot, which may seem inconvenient when there are some that you can do once, the fact that it's all natural and we actually give the joint a chance to adapt week after week for 5 weeks, we actually get better coverage in a longer period of time instead of just putting one big blob in and waiting for it to help. And so we get great results with Suparts. But with some, that's just not enough. So the next thing we recommend, if you're far enough along and or Suparts is something you've tried in the past, is no longer helping, is called platelet-rich plasma. We do a lot of platelet-rich plasma in our clinic, and we get fantastic results with it. And the beauty of it is it's your own blood that we use. We spin the platelets down when we draw a little tube of blood. It takes about 10 minutes. Those platelets are concentrated in a special tube, and that tube allows us to separate your platelets into another injection. And the way I explain this is, we would be just a big blob of millions of cuts and bruises if we didn't have platelets. So unfortunately, we don't get a lot of blood supply carrying platelets to our joints or tendons. And so we're able now to introduce growth factors that we would not be able to get into the joint or tendons by way of injection, and we just need your blood to do that. It's very safe, extremely effective. It signals your body's own stem cells to come in and repair, and so it's a very valuable treatment plan. The next thing I want to tell you is that if that doesn't work, or if it's really severe, is that we do cellular regenerative therapy in here, also known as stem cells. And in our clinic, we use umbilical cord tissue, which is the highest concentration for stem cells, and in some cases, amniotic fluid with growth factors to address the arthritic knee. So the other thing that is really big about our clinic that we look at is once we start to get some relief and we can actually grow cartilage with those stem cells, is, you know, there's scar tissue around the knee that's developed over the years, and that may need to be addressed. Scar tissue is painful and it's tight, and even after you're starting to make progress, there's sort of a footprint left from the process itself, and that stiffness has to be treated and dealt with. Next, bracing. We brace because we want to aid in the healing. We want to get rid of the inflammatory response that's making your life miserable, and only for a short period of time, but a proper brace that's fitted for you can make all the difference early on. So these techniques, and the fact that we also have athletic trainer and physical therapy assistant on site and exercise science people, they can help you determine what muscles around that knee need to be awakened again, and so that you can walk and support your knee correctly. This might mean that we need to address the hamstrings or even your pelvis. And in our clinic, we have chiropractic, so if we need to align your pelvis, if we need to straighten out some of the function of the joints and how they work, we can do that. We have a nurse practitioner who's wonderful at assisting us with some muscle techniques, trigger point techniques to address deep trigger points. And then we are able to do deep tissue massage and what we call SASTM, or sound assisted soft tissue mobilization. When we put all this together and take a holistic approach in here, we find that our patients are very glad they came. We hope that we can help you, because, you know, getting a joint replacement could be an option for much of your life, but certainly if you could prevent it, then we've really done our job, and we really appreciate the chance to help you. Please click the link below if you'd like to come in for an evaluation. I hope to see you soon.